Coming from a middle-income country, the major challenges are, I'd say, are around three main areas. One is a human resources point. I mean, we have a shortage of human resources on the clinical side, on the research side, and on the policy side. So introducing chronic diseases will face that challenge. Who is going to do the job? Secondly, the other challenge is the health system per se, poor people not having access to all the care, more importantly now for chronic conditions. And the third challenge, I'd say, is it's around the issue of understanding the changes in society in our settings, because it's not that everything is static. We have to work in a very changing environment. And that's the topic I'll be presenting in this forum, which is migration and health. In terms of human resources and solutions in terms of access to health, linked to innovative ways of testing new intervention areas to get access for poor people to healthy options. So in terms of human resources, we got very lucky to receive funding from an international network established Center of Excellence in Chronic Diseases. This is funded by the U.S. National Institute of Health, particularly the National Heart and Lung and Blood Institute, together with United Health. And they created an international platform, a very horizontal platform to invite people from low and middle income countries to be in an innovative framework to propose new solutions. To my end, that reflected into, when I said before, who is going to do the job, this network enabled us, with the proper support, to have a team very focused on testing new research techniques for NCDs in chronic diseases. That's what the name of our center is called, Cronicus, Center of Excellence in Chronic Diseases. So that's our contributions towards the human resources crisis. And the second solutions in terms of improving access to healthcare, we're testing with our group innovative ways to use currently or well-established social infrastructure to introduce healthy diets, healthy nutrition opportunities. We all know from developing countries that eating healthy is important, but also eating healthy is costly, it takes more time, and usually poor do not have access to that. So concretely, we will be testing whether or not using community kitchens. This is a grassroots organization that works in Peru. We could capitalize on those programs to introduce healthy habits. So we'll be working closely with these families and these women to explore how feasible, how costly, how practical, how realistic are the promotion or the introduction of introducing fruits, introducing salads, reducing the amount of oil they use in cooking, and reducing the amount of salt. Those are maximizing on what's going on right now to see if we can bring on the next step. Given the transitions that most of our developing country settings are going through, we know that urbanization is blooming, cities are growing, populations are growing and getting older, but also there is a lot of urban poverty, there's a lot of rural people coming with this idea that things in the city are better. So what in reality is happening to that people in terms of their cardiovascular and metabolic risk profile? And we don't have a clue. We're assuming that these people will become like urbans, but we are overlooking tremendously the situation that these people are going through. Mental health conditions, stress, poor nutrition, poor access to healthcare, which all will interact and will mean, and will give us perhaps a different profile in terms of their health status. The most striking message that I'm taking, I heard it today in the morning, is let's not sit in our offices and let's not make up these policies in the developed country. Let's go out and listen to the people what they need. And it was a very powerful message from a woman from Uganda. Say, we're all here in Geneva, it's all very cozy and fancy and goodwill, but if we do not have frontliners in our table, most of our policies and recommendations will fail. And I'm very grateful for this forum to be a very international, very lively forum to put the voice of everyone on the table.